Hi everyone. I hope everyone is having a good day. And okay. I hope you have a fan going. It's not causing much noise. Alrighty, so today I'm going to be covering chapter 13 and it's called Choosing a Caregiver. One of the greatest influences on what happened to you during labor, especially as this relates to medical interventions, procedures, and medications, depends upon whom you choose to be your caregiver. In North America, there are 3 separate professions that provide maternity care: midwives, family doctors, and OBs. Hi, Mari. Happy anniversary. I think it's Mari Sanchez, right? Yeah. Midwives are specialists in normal pregnancy and birth. Midwifery care is individualized and focuses on minimizing the use of OB intervention when possible. Midwives provide all the prenatal care healthy women need. The midwifery ideal is to work with each woman and her family to identify unique physical, social, and emotional needs. Midwifery care is associated with few episiotomy, fewer forceps and vacuum extractor deliveries, fewer epidurals, and fewer cesarean sections. Midwives are trained to identify the small percentage of births in which complications develop and refer these to OBs. In the United States, there are 3 basic categories of midwives: certified nurse midwives, CNMs, are registered nurses and have completed additional postgraduate training and institution accredited by American College of Nurse Midwives, ACNM. Direct entry midwives are those who did not become registered nurses as a step toward midwifery training. There are 2 varieties of certified direct entry midwives in the United States: certified professional midwives, who are certified by the North American Registry of Midwives, and certified midwives, who are certified by the ACC and the credentialing arm of the American College of Nurse Midwives. In several states, another variety of direct entry midwives is licensed to practice. Usually these midwives are called licensed midwives. Not all midwives are certified or licensed. Most of the home births in the United States are attended by some variety of direct entry midwife, with approximately 8% of home births being attended by certified nurse midwives. Birth centers are staffed by all varieties of midwives. The bulk of certified nurse midwives work in hospitals. About 13% of family doctors practicing in the United States provide maternity care. These general practitioners tend to be somewhat more prevalent in rural areas. Many do not have surgical privilege and, like midwives, must refer to an OB if a cesarean becomes necessary. It would be a mistake, though, to consider care by family doctors or midwives inferior to that offered by OBs, simply on the grounds that OBs need not refer care to a family physician or to a midwife if no complications develop during a course of labor. Several studies have found that family doctors tend to have lower rate of OB intervention than OBs do. Some family physicians practice more within a midwifery mode because part of their residency training involved teaching by certified nurse midwives. Other family doctors practice much like OBs, since in many states most receive the bulk of their OB training from other OBs. OBs are doctors who have specialized in obstetrics. Their medical training is focused on detecting and treating the pathological problems of pregnancy, sometimes labor and birth. As surgeons, they perform cesarean sections and forceps and vacuum extractor births. In North America, for historical reasons, they far outnumber midwives and family physicians who provide maternity care, in part because of their numbers and long-held dominance over the other two professions. They design most of the hospital maternity department rules and routines. They usually determine the role played by family doctors in maternity care. OBs are trained to detect pathology. When they detect it, their training focuses on intervention and treatment. Look at from a world perspective. The role of OBs in North America is unusual since in North America, OBs serve as caregivers for healthy pregnant women, as well as for women who are ill or high risk. When OBs provide maternity care for healthy women, they often apply interventions that are appropriate for complicated pregnancies to all women. So, things that should happen only to women that are having complications, they do it to everybody. When OBs provide maternity care for healthy women, they often apply interventions that are appropriate for complicated pregnancies to all women. In most countries, OBs focus on providing care to women who are ill or have developed a complication. Interviewing a caregiver. As I've mentioned before, it is not possible to determine solely by licensure, certification, profession, or appearance the philosophy and practice of any given practitioner. Not all midwives work within the midwifery model of care. Not all doctors work entirely within the limits of medical model of care. Women are not necessarily more sensitive than men when it comes to providing maternity care. What I'm saying here is that you need to be a smart shopper. One of the best ways to educate yourself about the care possibilities in your area is to interview several practitioners. Notice how you feel during and after your talks with them. Keep in mind that some practitioners may tailor their answers to match what they think are your prejudices. You might ask, for instance, what is your practice concerning episiotomy on first-time mothers? How often does this happen? Respect your own tuition. If you get good answers from a given practitioner, but you just don't feel comfortable with that person, you will probably be wise to continue looking for a good match. What follows is a list of specific questions that you might ask. Home birth midwife. So, if you guys want me to put this in a post, well, maybe I will. I don't know. I'll have to make sure I cite my sources and stuff because I don't want it to be taken down. But I'll post these questions for you guys. Home birth midwife. How, when, and where did you receive your midwifery education? So this is for a home birth midwife. Excuse me, guys. Are you certified or licensed? What physician, collaboration, or backup do you have? Do you maintain statistics from your practice? And may I see them? How many women are due within a month of my due date? Do you work with a partner? If so, what are her qualifications, his or her qualifications? What is your plan if someone else is in labor when I go into labor? Do you use pharmaceutical products to induce labor? What prenatal tests do you require? What are some recommendations about my diet during pregnancy? You should be wary of anyone who recommends a weight gain of less than 25 or 30 pounds. If you are overweight, you should not be encouraged to lose or avoid gaining weight because of a certain number of pounds. Watch out for practitioners who do recommend salt restrictions too. Do you carry an oxygen tank to births? What methods do you suggest to alleviate labor pain? Is your certification in neonatal resuscitation up to date? To what hospital do you transport if this becomes necessary? Who will go with me? How often will you make postpartum visits? Do you participate in regular peer review? So that's for a home birth midwife. This is for a hospital-based midwife. How many women do you have to care for at once? Who will care for me if you aren't at work when I go into labor? What prenatal tests do you routinely do? What procedures do you do routinely for women in labor? Are you open to having a doula in addition to my husband/partner? May I eat and drink during labor? Can I have intermittent monitoring rather than EFM? What methods do you suggest to alleviate labor pain? Are there tubs or showers at the hospital? Is it likely that I can use one? Is there a time limit on labor? Hi, Minna. I'm going over questions. I'm going over questions that you should ask your midwife, doctor, home birth midwife, doula. So, may I eat or drink during labor? Can I have intermittent monitoring rather than EFM, which is the monitors that are attached to you? Booga butt, come here. Come say hi to Auntie. Come here. Let me see. Okay, he might come. He's busy playing. Come here. Are there tubs or showers at the hospital? Is it likely that I could use one? Is there a time limit on my labor? Can you put my baby on my chest, skin-to-skin contact after birth? Will you wait to clamp the umbilical cord until it has stopped pulsating? What kind of postpartum care do you do? Oh, now I can hear. Wait, I can't hear you. Oh, you can hear me? Oh, okay. I'm sorry. I'm trying to, I hope that it's not cutting out. I have to use headphones because I have to use a fan because my phone overheats. Anyways. So, I hope you can still hear me. OB or family practice doctor? So these are questions to ask your OB or family practice doctor. How likely is it that you will be present when I give birth? If not, who will be there instead? Can I meet all of your partners? What is your policy on ultrasound? What forms of pain relief do you recommend? How many women in your practice give birth without pharmaceutical pain relief? What do you think about doulas? How often am I likely to see you while I'm in labor? Oh, it's okay. Don't even worry. I'm just having phone issues lately, so it's totally okay. What prenatal tests do you do routinely? What labor procedures do you do routinely? What methods do you suggest to alleviate labor pain? Can my baby's heart rate be intermittently monitored by the nurses? Do you perform episiotomies routinely? How often do women in your care give birth without an episiotomy? Can I drink and eat during labor? If I go into labor, check into the hospital, and my labor slows down before I get very far, can I go home? What is your induction rate? What methods do you use? Can I walk around in labor? Is there a time limit for labor? How long can I push? Can I choose the position for giving birth? Can I give birth on my hands and knees if I like that position? What is your cesarean rate? This may seem like a personal question, but if it's a female, can I ask if you've ever given birth vaginally? This may seem like a personal question, but if a male and a father, can I ask if any of your children were born vaginally? What is your forceps and vacuum extraction rate? Will you cut the umbilical cord after it quits pulsating? Can you put my baby on my chest, skin to skin contact after birth? And then these are questions to ask your doula. What training have you had? Do you have any other responsibilities that might keep you from being available when I'm in labor? Can you provide references? How many clients have you already worked with? Can you tell me the range of situations that you've worked with? Remember that a postpartum doula's job to care for you so that you can focus on your baby's care. She might do housework or cooking. You want a mature person who will truly listen to you, someone who will be calm even if you're feeling overwhelmed and stressed. Why you asking all them questions? Why you asking all them questions? I know. Our poor doctors, it's like, what have you done? What have you done? Come here. Here. You want an animal cracker? Come here. Look what I got from Costco. A huge thing of animal crackers. Come here. Alrighty. Any of the above questions provokes if you're interviewing someone, and if any of the above questions provokes resentment, sarcasm, hostility, scare tactics, or vague or patronizing answers, keep shopping. You would likely not put up with such treatment in a restaurant, and finding the right caregiver for you during pregnancy and birth is a far more important decision to make than where you would eat a meal. Did I have some more snackies than you? Yes. He has so much snacks. I have water, and he has animal crackers. So that is it for chapter 13. Tomorrow we'll read chapter 14. It's a vision for midwifery and mothers in the 21st century. So that'll be a good chapter. And then that's the last chapter. We're almost done. That's crazy. Hi, Mom. Boogabutt. Come here. Come here. Come say hi. Come here. Okay, hold on. Wait. I'm gonna get you. Got you. Come say hi. Say hi. Yeah. Book. Say hi. Pencils. Cookies. You want one? He asks what everything is. I love your chair. Oh, thanks. This is the chair that I think Miss Torres gave us. Say hi. Light. Pencils. He's looking at everything over here on my little table. No, sir. Let's not touch that. Say hi. He's learning so many words. Where are you going? Where are you going? Alrighty, I better get off, guys, but because I have to upload this onto YouTube. But Say bye. Say bye. Blow kisses. Say bye. Bye. Love you. Grandma says she loves you. Auntie says she loves you. Say, love you. Love you. Love you. Love you. Okay. Love you guys.